Thank you for joining me today. I'm here with Secretary Jerome Lothridge and Secretary Casey Schrum to give you an update on our fight against COVID-19. First off, our curve is flattening in Oklahoma, and I am so proud of the job that Oklahomans are doing. We are making tremendous progress, but like I've said before, now is not the time to take our foot off the gas. If you remember, I said earlier this month, what we do together over the next 3 weeks will greatly determine our outcome of what we can do after April 30th. That's still so true today. We need to continue with social distancing and washing our hands frequently and limiting our trips to the grocery store and the pharmacy. So because we're flattening the curve, we are working on plans to reopen our state. But let me be clear, we're not out of the woods yet. We have to continue to be responsible about our trips to the grocery store and the pharmacy by only sending one person and make sure we practice physical distancing while we're there. We've talked about how the models get better over time, like the hurricane models get better as they get closer to shore. Our models in Oklahoma are continuing to be revised and get better with more testing. We have over 80 test sites available all across the state. And let me be clear, we want everyone that has COVID-like symptoms of a fever of 100.4, shortness of breath, to get tested. You can call 211 or go to coronavirus.health.ok.gov to find a location near you. I wanted to show the initial IHME model. This came out in late March, and it's probably up on your screen right now. It's the one the White House referenced, and it showed a peak of approximately 5,000 hospital beds needed in the state of Oklahoma. On April 1st, we continued with my Safer at Home order for the vulnerable population, as well as we extended our non-essential business ban all the way through all 77 counties. You'll see the graph on April 1st came down to a little bit around 3,000 beds needed in the state of Oklahoma. And then that last version on April 8th is the version we showed you last week when we announced our hospital surge plans. That version projected our peak hospital demand on April 23rd at 1,115 hospital beds needed. We currently have 4 times that available beds in the state of Oklahoma. The latest graph pushes our peak back to April 30th and also continued to flatten and showed a max bed of 815 needed in the state of Oklahoma. Even under the model's worst case scenarios, Oklahomans, we are in fantastic shape on hospital beds. This graph also shows our total hospitalizations. These are people in the hospital and the ICU is the very bottom piece of that graph. Those are the actual numbers today. And we have about 420 or so in the hospital across the state of Oklahoma. That number, the significance of that number, it stayed flat for the last 17 days. I've been committed to making decisions based on scientific data and the advice of our public health sectors here in the state of Oklahoma. While we need to keep up our guard, we are looking and we are working on a plan to safely open up the state. Like we've done all along, we will make our decisions based on data here in Oklahoma and the advice of our public health professionals. Earlier this morning, I talked to the mayors from across the state of Oklahoma. I personally had a conversation with Mayor Holt from Oklahoma City, Mayor Bynum from Tulsa. I think it's important to issue statewide guidance, set of guidelines on how we can safely reopen the state. We suspended elective surgeries to do a couple things. Number one, to protect hospital beds in case of a surge and we needed more hospital beds. Number two, to protect PPE for the healthcare workers who are treating COVID patients. Our hospitals have been great partners with the state, but many of them are struggling with low numbers. Hospitals have had to furlough workers in some cases, and I've heard of nurses, single moms, who have lost their jobs because the demand is so low. Because we feel good about our hospital numbers and our PPE, I am announcing today that elective surgeries can resume in 9 days on April 24th. Our Governor's Solutions Task Force is still continuing to be proactive and preparing for anything COVID might throw our way. We will continue to monitor our hospitalizations and our PPE from around the state day and night. We're also working with our health department to come up with guidelines to reopen restaurants and non-essential businesses in a safe manner. For the essential businesses who have stayed open, you're doing a really good job. Thank you for innovating and finding safe ways to continue to serve Oklahomans and protect your workers and your customers. If your business has employees who can work from home, we need them to continue working from home when practical, and we'll phase them back into the office over time. We've been training our healthcare community on our comprehensive surge plan. It's called Project Echo this week. We had 850 doctors and healthcare providers on a webinar just this morning. Part of that plan also includes innovative ways to use telemedicine so every Oklahoman has access to the level of care that they need, no matter where they live across our state. I've also asked Dr. Casey Schrum, who's Secretary of Science and Innovation, to give us an update on the Project Echo. Dr. Schrum?
Thank you, Governor. I want to provide more detail around how we utilize telehealth during our anticipated surge. Telehealth is an innovative way to expand the existing capabilities of our healthcare systems all across the state. This will allow Oklahomans who do not need a higher level of care, but could utilize specialty services to remain in their communities and closer to their loved ones. We will deploy 54 telemedicine carts to strategic rural locations across the state. As we look to the future in anticipation of reopening Oklahoma, we'll make decisions based on data and on availability of resources that will be needed. We will begin expanding our surveillance and tracking capabilities. We ask that Oklahomans be patient and continue to be diligent in your social distancing, practice good hand hygiene, and wear masks when you're in public places as recommended by the CDC.
Thank you, Dr. Schrum, for that wonderful update. Oklahomans, I just want to reiterate how important it is that we continue to practice our social distancing. We've got to wash our hands, stay at home if you can, stay at home if you're feeling sick. One of the things I love about Oklahomans is our hardworking DNA that's part of our fabric. And I know that Oklahomans are hurting right now. We have, I think it's 211 folks that have applied for unemployment. And I just want you to know that we are going to get through this. Light is at the end of the tunnel. You have been doing a fantastic job of social distancing, and we have flattened the curve to your credit. So just a little bit longer, I want everybody to stay home, stay safe, and stay strong. God bless you, and God bless the great state of Oklahoma.
Question for the Governor or the Secretaries?
Governor, I'm sorry.
I was just going to ask what you would say to those that were driving around the Capitol today, frustrated because they're ready to go back to work. What would you say to them that they're feeling that way?
Yes, so I know that Oklahomans are frustrated, ready to get life back to normal. That's, our plan is to do it safely. My orders, the executive orders are through April 30th. We extended the Safer at Home for the vulnerable population through May 6th. But we're working on plans to open up. We'll have more things in the future. We're going to do it safely. I've met with the Restaurant Association. Our health department is working on a safe way that we can start opening those restaurants back up. Our non-essential businesses. We started with elective surgeries in 9 days to get those back up. We're going to monitor the data, and I'll continue to let Oklahomans know, but we have to continue the social distancing to make sure we don't have a new surge. But we have to keep on this path through April 30th.